Hi everybody, and welcome to the session on managing medications. My name's Emer, I'm a pharmacist, and today I want to cover three main topics with you. Firstly, some best practice advice for managing your medications in general. Secondly, a broad overview of inhalers. And thirdly, vaccination and smoking cessation. I know you've already had a session on smoking cessation. I just want to touch on one or 2 points in relation to that. So the first topic is best practice in managing your medications. First things first, it's really important to know your medications. So we know that many older adults in Ireland will be taking upwards of 10 different types of medications daily, and it can be very hard to keep track of all these. For each of your medications, it's very important to know what the active ingredient is, why you are taking it, and how you take it. It's essential to know what the active ingredient is so that you don't double up and take 2 products with the same active ingredient, or take 2 medications that are from the same drug class. This is important, especially now as we have more and more medicines which are dispensed as generic. So the brand leader has come off patent, and lots of different manufacturers are now producing the medication. I use the example Panadol and paracetamol here. Paracetamol is the active ingredient, Panadol is the brand name. But paracetamol can be found in many other products for cough and cold remedies, products for sinus pain, and is also available on its own and simply called paracetamol. If you're not sure what the active ingredients are in your medications, have a chat with your pharmacist the next time you pick up your prescription and ask them to go through them with you and write down the active ingredients of your different medications. I would recommend you keep a medicines list to help you keep track of your medications. It doesn't have to be anything fancy, a simple A4 page with a list of the medications, the brand name if it's the same brand every month, the name of the active ingredient, the strength, say 10, 20, 30 milligrams, and when you're taking it. You can then use this to have a conversation with your GP or pharmacist about what each medication is, why you are taking it, and whether any of the medications you're taking are no longer necessary and could potentially be discontinued. Fold it up, put it into your wallet or bag, and keep it with you. Update it if your medication changes. It can also be useful for reordering your prescription from your GP and pharmacy, or if you're admitted to hospital unexpectedly, you can provide this important information to the staff there, which reduces your risk of a medication error. Additionally, if you ever run out of your medication and you cannot get to your regular GP or pharmacy, any pharmacy can give you a 5-day emergency supply of your regular medications, within reason, if you can show them what medication you take regularly. The second item I want to cover in terms of advice for managing your medication is how to improve adherence, which is how well you take your medication as prescribed. Firstly, try and simplify your medication regime as much as possible. So the medications are only taken once or twice a day, for example at breakfast and at tea time. Get into the habit of taking them at the same time each day. Obviously there will be exceptions if you're taking medication more frequently. An example that comes to mind are medications to control the symptoms of Parkinson's disease, which could potentially be taken up to 4 to 6 times a day. That's just one example. So have a chat to your pharmacist about simplifying your regime. Secondly, keep all your medications in the same place in a safe area out of the reach of children. Keeping your medications in the same place will reduce your likelihood of forgetting one. Now this includes your inhalers, which you take regularly, once or twice a day, depending on the inhaler. Treat your inhalers as you would your other regular essential medicines, say those to treat high blood pressure, high cholesterol, irregular heartbeat. Obviously this doesn't apply to a short-acting reliever which you should have on your person if you need it. Thirdly, if you are finding it difficult to manage your medications or have visual impairment which makes it difficult to follow the instructions, ask your pharmacist about putting your medications into a blister pack for you. 2 other points I want to raise in terms of medication. First point, if you notice a new symptom or problem, it may actually be a side effect of a new medicine that you have started on, or a sign of an interaction between a new medicine and an existing one. It's important to be aware of this and raise this with your GP or pharmacist if you have any concerns. Second point, it's important to get your information on medications from a reliable source. There's a lot of information out there. Often it's not factually correct, and some of it can be quite hard to read, for example the package inserts in medicines. I recommend an Australian organisation that I worked with previously. It's called NPS Medicine Wise. It's a government-funded non-profit organisation that aims to provide independent, balanced information on medicines. If you go onto their website, they have a tool called Medicine Finder, where you can enter in the name of the active ingredient of your medication, and it provides you with useful, well-written accurate information about that medication. The second topic I want to cover today is the use of inhalers, which are the backbone of managing respiratory conditions. There are two main messages I would like to get across in relation to inhalers. The first key message is to take your inhalers as prescribed, even if you start to feel better. The second key message is the importance of using them correctly, what we call good inhaler technique, and I'll come back to that shortly. Going back to our first message, taking your inhalers as prescribed. As with any medication, it's really important to know what the active ingredient is, why you are taking it, and when do you take it. Depending on whether you have asthma or COPD or both, it's likely that you will be on different medication regimes. That's why it's really important to know what your diagnosis is, as the management of them differs. In terms of the active ingredient, there are two main medication types. Bronchodilators open up your airways and help you breathe more easily. Corticosteroids reduce inflammation, reduce swelling in the airways. There are two types of bronchodilators, long-acting bronchodilators and short-acting bronchodilators. Long-acting ones should be taken regularly, every day, once or twice a day, depending on the product. It's important to know that you won't get the same immediate symptom relief from a long-acting inhaler as you do the short-acting one, but that doesn't mean they're not working. They have a different purpose from the short-acting one, which is more of a reliever that you take when you feel breathless. There are numerous high-quality studies which show that continuous use of long-acting bronchodilators reduce your likelihood of a flare-up and being admitted to hospital with a flare-up. If you have asthma and you find that you're using your short-acting bronchodilator, your reliever, frequently, you need to speak to your GP about your medication regime. If you have asthma, you might find that you're using it every day for breathlessness, and that's fine. However, if you find that you need to use it more than a couple of times a day, have a chat to your GP about your regime and how you are using your inhalers. The second medication class covers inhaled steroids. Depending on your condition and whether you've had one or more flare-ups, it's likely that you'll also be using a steroid inhaler. Again, if you're prescribed a steroid inhaler, use it every day as directed. Rinse out your mouth each time you use one, as you don't want to get a world thrush. If you are taking separate inhalers, always use the bronchodilator first before using a steroid inhaler, as it opens up the airways. Most of the inhalers now have a 30-day supply in them. I'm talking about those that are to be taken regularly, not the short-acting relievers which you take as required. They should last longer than a month. If you find that you have a couple of unopened boxes of your regular inhalers at home, it should really be a red flag that you're not using them as regularly as you should do. You should treat your inhalers as you do your other essential regular medicines, such as those for high blood pressure, for cholesterol, for heart failure. The second key message in relation to inhalers is about good inhaler technique. I can't reiterate enough how important it is that you're using your inhalers correctly so that the medication in your device reaches your lungs so you get maximum benefit. We've had an influx of new devices over the last few years, and some of these can be very daunting to look at. The best advice I can give you is to have a look at the Asthma Society of Ireland's website. It's excellent. Scroll down to the bottom of the page and you'll see a section called Inhaler Technique Videos. This section gives you guidance on all the inhalers for asthma and COPD by type of device. You won't see the brand name there, just the device. For example, Discus, Clickaler, Handyhaler, Meter Dose Inhaler, the puffer. Click on the picture of the device that's relevant to you and a short video will pop up. They're each less than 1 minute long. Along with the videos, there are also one-page tips for each of the devices. You'll find a lot of practical tips on here, such as if you need to put a capsule in the device, how do you do that? How do you prime the device? Do you need to shake it? How do you breathe in? A short, sharp inhalation or a long, slow inhalation? This differs by the type of device. When does the inhaler expire? Some actually only last for 6 weeks from when they're first opened, and you should write the name of opening, the date of opening on the device. Have a look yourself or ask someone to help you navigate to the correct device. If you're still struggling with your inhalers and you can't use them correctly, it's really important to raise this with your GP, your respiratory nurse or your respiratory doctor. There are tons of inhalers available and they can find an alternative inhaler that suits you better. The best inhaler for you is the one that you can use and you will use. In terms of disposing of your inhalers, there's actually now a recycling scheme in Ireland for inhalers whereby you bring them to selected pharmacies and they arrange for them to be collected and recycled. Importantly, not every pharmacy is involved in the scheme yet, so go online to the website tiva.ireland/inhaler recycling to see which pharmacies in your region are participating. This doesn't have to be your regular pharmacy, you can bring your inhalers into any pharmacy that is participating in the scheme. Lastly, a few quick words about vaccination and smoking cessation. Make sure you get your flu vaccine every year at your GP surgery or pharmacy. Your GP should also offer you the pneumococcal vaccine, which helps protect against pneumonia and other bacterial infections. Those aged 65 years and older should get a once-off pneumococcal vaccine. It's not every year, it's simply once off over the age of 65. Finally, giving up smoking is one of the most important things you can do for your lungs, regardless of your age or condition. Smoking cessation has a major positive influence on your respiratory health and how your condition actually impacts you. It decreases COPD progression, morbidity, how sick you are, and mortality. There's lots of support in Ireland to help you quit smoking, and I know you've had a session on this already. Have a look at the COPD Support Ireland website or the Quit Smoking section on the HSE website. They give really practical advice on how to maximise your chance of success in quitting. For example, how to deal with cravings. If you prefer to speak with someone, the National Smokers Quit Line is open 7 days per week from 8 a.m. to 10 p.m. Call 1850 201 203. Nicotine replacement therapy is available in many forms without a prescription in Ireland. If you have a medical card, some of these are actually covered by the card. Chat with your GP about which would be the best for you and how to get started. Also, try to reduce your exposure to passive smoking. That's people in your environment who smoke. Raise with them how this impacts your condition and encourage them to quit. Finally, there's lots of really helpful information that can help you manage your condition. I've already mentioned the Asthma Society of Ireland and COPD Support Ireland. I also find the British Lung Foundation website very good. I just want to conclude the video by saying well done on participating in the programme and for watching all the sessions. It would obviously be much nicer to do this in person and answer your questions, but these are unprecedented times. So I hope you found this useful and learned important tips for managing your medications. I would really encourage you now to draw up your medicine lists and use this to have a conversation with your GP and pharmacist about what's best for you.